As a pharmacist, I'm sure a lot of my colleagues all over Nigeria are wondering the same. What is the origin of Yodi? If you are not familiar, let me explain to you. A couple of people in this country of ours use the medication called Dexamethasone to increase and they call it Yodi. My very first experience as a pharmacist, I had just come out of pharmacy school, and this woman came in, a market woman, because the first place I practiced was near a market, and she came in and said, "Efuni ni Yodi kan," and I'm like, what? It was the sales girl that explained to me that she was asking for Dexamethasone, and they use it to increase behind weight. What is the origin? Why do we use such a medication for purposes? Permit me to use because I don't know what else to say. Dexamethasone is a corticosteroid. It is approved. It was designed and approved to be used for severe allergies, inflammation. It's basically a steroid. It does what steroids do, especially for inflammation and allergies. So the side effect that comes with weight gain, these people decided to capitalize on it, to use it to increase behind capacity. Please subscribe, like, and share my videos as much as possible. They are helpful to me so that more people can like my videos and more people can watch them. So please like, share, and subscribe. Hi everyone, welcome back to my channel. Today we are going to be discussing a very important topic that affects individuals globally and locally here in Nigeria. Okay, we're going to be discussing the hidden dangers of off-label medication use. Now, what is off-label medication use? In short, it is unapproved use of approved drugs. In the United States, for example, it is actually legal and common. But in Nigeria, it has another meaning, in the sense that people of their own accord, not healthcare practitioners, people of their own accord have come up with ways to use medications for their own self-serving purpose, apart from what the medication is approved to be used for. So that is off-label medications. In other case, in the Nigerian version, it is abuse of these medications. But in the stricter sense of the word, off-label medication use, it can be used, it is an approved medication that can be used for another ailment. Apart from what these medications have been approved for, healthcare practitioners can actually use medications to treat other ailments that they were not approved for by regulatory bodies. So that's the off-label use, which is actually legal and common. But in Nigeria, like I said earlier, people who are not healthcare practitioners use medications for other means rather than what it is used for. But in this case, it is not safe and it is illegal. So let's dive right in so you understand what I mean. The very first medication in this category of what we are discussing today is Dexamethasone. It's a strong corticosteroid that is used for inflammation. It's a corticosteroid that is used for inflammation and to suppress the immune system. In the injection form, it could be used to ripen babies' lungs. Okay, that's for another one. But in the Nigerian sense of it, we have people that use this drug for increasing capacity. Please, Dexamethasone has the capacity to increase your blood sugar because it's a steroid, and not just that, increase your risk of infections. So if you use this over time, you just find out that these people keep falling sick and they keep coming back to use other medications to treat diseases that they caused on themselves. So as much as possible, use it if you have an immune reaction or if you have an inflammation. Next up, Viagra. Viagra is an antihypertensive medication that is indicated for pulmonary arterial hypertension. That is what it was meant for, as well as erectile dysfunction. How does it work? It relaxes the muscles of the arteries so that blood can flow to the blood vessels supplying blood to the lungs. Now, how is it being misused? We have people who are not diagnosed with erectile dysfunction using Viagra. If you use it, you stand a chance, a very high chance of having low blood pressure. And if this happens, if you've not been diagnosed with erectile dysfunction, don't use Viagra. You stand the risk of having low blood pressure as well as a whole lot of other side effects that you do not want to expose yourself to. So if you've been misusing it recreationally, please stop. Viagra is not to just increase your sexual libido or make you last longer in bed. It is a prescription medication. Okay, please let us desist from that. If you know anyone using Viagra, tell them to stop. If they are using it personally, tell them to stop. In the long run, it doesn't pay. The third one on our list today is Prednisolone. Now, this is a personal experience. I know someone who uses this to pass urine. Says it sort of makes her relaxed and she passes urine and she's fine. Prednisolone is another steroid. Whatever steroids do, they increase your risk of infections, yes, because they'll suppress your immune system. Not just that, they are prescribed for severe allergies, for inflammation and allergic reactions and all. So don't use Prednisolone. Excessive use of it can increase your risk of diabetes, basically increasing your blood sugar. Not just that, it also affects your immune system if you use it for a long period of time without a prescription. So please stop. These dangers are very, very serious, critical. Next on the list, Cyproheptadine, commonly known as Cyprigold in Nigeria. People go to pharmacies and request for Cyprigold in different forms, either as a syrup or as a tablet. But do you realize or do you know that Cyprigold is actually an antihistamine? If you have allergic reactions, severe or acute allergic reaction, Cyproheptadine is used to alleviate the symptoms. But the side effect, which is weight gain, is what these people capitalize on. It is wrong. Oh, wrong. Please. And remember, as I said, if you misuse it, the weight gain, it's not going to be forever. And not just that, you're giving yourself other side effects, right? You can have drowsiness, dizziness, heart rhythm abnormalities from using Cyproheptadine. So please, if you use it to gain weight or to gain weight or to increase your appetite, there are other medications you can use to stimulate your appetite. Please stop using Cyproheptadine for weight gain purposes. Next on the list, Tramadol. Tramadol is a pain relief medication. We use Tramadol for people orally to treat people that have pain, muscular pain, neuroskeletal pain. But Tramadol is even prescribed for people who can tolerate it. One of the major side effects that makes Tramadol very dangerous is called respiratory depression. If you use Tramadol in a wrong dose, or if you are somebody who doesn't, as a person, as a pharmacist, I have respiratory depression. When I had respiratory depression, the first time I used Tramadol, and after then, it was prescribed for me, so I told the doctor and he changed my pain medication when I had a surgery. So imagine if I can have that kind of issue. Imagine people using Tramadol unprescribed. They use it to stay longer in bed. That's how they abuse it, to stay longer in bed. And not just that, they use it to get high. Two things, those are the ones that I know. If you know the others, you can say. But the two that I know of, people use Tramadol to want to stay longer in bed. They mix it in things to stay longer in bed. Not just that, they also use it to get high. Tramadol is extremely dangerous. Not only will it cause respiratory depression, it also causes abnormalities in your cardiovascular system. So as much as possible, stop it. If you need help, seek medical help. All right. Next up on the list, triple action creams. Triple action creams are topical medications, that is, they are medications that you apply on the skin for fungal, bacterial infections, and obviously allergic reactions. So most times these creams contain an antifungal medication, antibacterial medication, and a steroid. But how is it being used off-label in Nigeria? They use it mixed in creams for lightening purposes. What causes that lightening purpose, that lightening effect, is the corticosteroid. Now, you are not supposed to use under prescriptions. You are not supposed to use triple action creams longer than 2 weeks at a stretch. If you do that, you will expose your skin barrier to the fungal infections and the bacterial infections you were trying to treat in the first place, and it becomes a vicious cycle. So as much as possible, if you know anybody using it, please stop. And the worst, please don't use this mixture on children. It will pass their skin barrier and go into their bloodstream. I beg, please stop using triple action cream for these things. They have long-term side effects that you cannot begin to imagine. Okay, finally, cough medications, especially medications containing cough and flu medications containing dextromethorphan as well as codeine. People use this for recreational purposes, to make people to sleep, to make people to get high, mixed with drinks. They all, instead of using them for colds and flus in specific doses. As much as possible, these things are dangerous for you. They will always affect the way your heart pumps blood. They affect your cardiovascular system. Yes, not just that, people begin to have hallucinatory effects, especially with dextromethorphan. So as much as possible, stop using these medications for what they have not been approved for. That's drug abuse. I've differentiated between off-label use as well as misuse of these medications. Finally, choose to use drugs according to how your doctor has prescribed them. Okay? If your doctor has prescribed your medication, use them. Do not get medications from your neighbors. Don't get medications from your friends. You don't use approved medications to increase one side of your body. It is dangerous for you. So I hope my video today was very informative and helpful. Thank you for watching, and see you in my next video. Please subscribe, like, and share my videos as much as possible. They are helpful to me, so that more people can like my videos and more people can watch them. So please like, share, and subscribe. Thank you for watching. See you in the next video. Bye.